Well, our disciplines really changed. We started off my career here where the dietary goals were just coming out with the Senate Select Committee on Nutrition, which got nutrition scientists and my department head at the time in a great tisfit that politicians were dictating what people ate. And I was always of the belief that we had enough nutrition science data to say we can affect a reduction in chronic disease if we look at what people put in their mouths. And I was always into prevention. I had never been trained in prevention in England, trained in clinical dietetics and nutrition. It was always how do you manage a disease, not how you prevent it. So when this came out from there in 1980, we had the first publication and first edition of the dietary guidelines. And Congress mandated that every 5 years, the United States Department of Agriculture and Department of Health and Human Services would convene a scientific panel to look at the nutrition science research worldwide to come up with guidelines for healthy Americans that would be prudent for everybody to adhere to try to promote health, prevent disease, especially chronic disease, which is where healthcare dollars are going. So we've just now got the 2010 dietary guidelines released. And you see, if you just read those themselves, you see how things have changed over all these 30 years. And every 5 years, there's a new edition. And there's a scientific panel report with an excellent review of the research. So I've loved what I've done because what I try to do is you have to take that science, and the challenge is to translate it. And you'll hear the public say to me, oh, Jennifer, one day you say do this, one day you say that. And I said, that's what makes our field so exciting and dynamic, because it changes. There's always something different to us to talk about. We always have something new to say. It's a rapidly changing field. And to some, especially some lay public, they get, oh, I don't listen to you anymore because you just never know what you tell us and it changes. Well, science changes. We know more. We know the role of phytochemicals now, antioxidants. Now you're all aware that there's a type of fat that food industry made trans fat. Well, now that's there. We'd like people to start cutting down on sodium. That's one of the big challenges that I think is facing now within our eating patterns and food that we have. How did I become interested in what I do? I think working as a clinical dietitian in Bergen, Norway, you only have a finite period of time to visit with a patient at the bedside. And you're telling them a low sodium diet. You're telling them what to do to manage a disease. They're already into a medical facility requiring attention. They've just been diagnosed with diabetes. Those moments are not the best teachable moments. And when I first came to Colorado State, I was asked by Dick Jansen, our department head at the time, to work and coordinate the federal program FNAP. And then on the side, I got a call from Extension, and we had a health education specialist, and to talk to the department head. And they wanted someone to work on the nutrition aspect of cardiovascular disease. And my father had died of a heart attack before I first came to this country. And I became very interested. And I had also, with my experience of a clinical dietitian, become somewhat frustrated that you can give knowledge, but knowledge does not lead to behavior change. How do you design a program to truly change behavior? And that's when I got excited about what to do to reduce the risk of heart disease. You're never going to tell anybody you can prevent it by eating this way, but we do know you can prevent and lower the risk. And you may not prevent that heart attack from occurring because there's many factors involved. It's not just food intake, but that's a key lifestyle factor that everybody's recognizing is more important. But many people design education programs to give knowledge. Put facts on the page, write a curriculum, get it so it's going to give you knowledge. But knowledge in and of itself will not be designed to change the behavior you're targeting. So I would look at the issues that were done, and that's often, and what I will always tell, and what I trained all my students to say, you have to listen to your target audience. You cannot sit around a table and decide what you're going to do and how you're going to do it. You need to find out what the recipient wants, and through that, I would find, because of my work with Extension, my beginning my career with FNEP and coordinating that program, and then moving into the faculty position and extension specialist, allowed me the opportunity to go further afield. So I've worked with all audiences, and right now, of course, the work that will continue beyond retirement is working with preschoolers, trying to address picky eating and looking at gross motor skills, two key behaviors to address the rising incidence of obesity in our young children. So we are doing, and that's incredibly fun. So yes, I've worked with limited resource audiences. I directed the food stamp nutrition education program for 10 years, and of course that's all those people with limited resources that we were targeting. But I've also looked at other ways and done other programs and other delivery strategies. And the cornerstone to everything is knowing how you design a program based on behavioral change models and theoretical frameworks. And once the students that I've trained get used to that, they realize it cuts your work down tremendously if you follow that simple framework and structure and look at those tenets in that particular theory and use that as a basis for what you do and how you do it and when you do it, and listen to the target audience. Our preschoolers tell us what they want. The preschoolers have informed us that we forgot something on one of our little Ollie Orange character. We forgot his shorts, and he's supposed to have shorts. Well, we all missed it. I did, my research colleagues did, the students did, but it was a little 3-year-old that says, "Where's Ollie's shorts?" I point that out as an example that I think it's too easy to cut corners. So it takes a long time to do a program well, but you will better get the results you're trying to attain if you follow some behavior change theory. And that's what I've tried to do, and that's what's excited me, because nobody had really been doing that. And I'll say to this day, knowledge doesn't change behavior. So you can have great programs out there, but then you look for the evaluation data. Where's the research? Did it work? How effective was it? And it's really looking at needs around Colorado, because as extension specialists, you're challenged with taking the research from the university and applying it so it's appropriate for citizens within the state. So I've worked and developed programs that have targeted Hispanics, migrant farm workers, the elderly, the athlete, children. What I was looking at is where we could make an impact to positively influence health, prevent disease. And the cornerstone of what I've tried to do at Colorado State is always designing programs that ultimately can change behavior in the target audience so that we can be effective and try to prevent disease and promote good health. La Cocina Saludable, that was developed to meet the needs of migrant farm workers. Obviously it was a bilingual program. And what we did that was very different is we recognized within that audience, when you do the needs assessment and understand what the target audience is telling you, they had great respect for grandmothers. So we trained the abuelas, or the grandmothers, to teach the program. So they would go to the parks when the migrant farm workers came off the fields. We covered southern Colorado, and we had 3 distinct areas. And the extension agents, of course, are integral to implementation and helping us facilitate the research to determine, did this program make a difference? So we had materials that could be easily carried, flip chart, all professionally done. And then the recipient, the target audience, said, we don't want paper materials. We get a lot of paper from WIC and other agencies. We want something we can use. And in further exploring through all our initial needs assessment, we realized they had very few kitchen utensils. So as a reminder for what the abuela, grandmother, was teaching, they received a specific utensil. So when we talked about making food fun, looking at feeding their young children, we gave them a measuring cup. And the measuring cup they'd never had before. And we gave them in another one, Make It Healthy, where we looked at the dietary guidelines. We looked at what we were saying to promote good health. And we gave them a big beaker and a spoon because they didn't have anything to make their tamales. And the abuelas had an apron. We gave a spatula when it was make the food safe for food safety. And the message on the utensil said it in English and Spanish. And to this day, you still hear people that kept those utensils that are reminded of the key messages that was being taught. So that was a fun project to do. And that was a several-year grant that was awarded from USDA to look at unique needs in your state, to see how extension could better work with other federal agencies, in this case, WIC, Women, Infant and Children Federal Program, for those with limited resources. Other programs I've done, I started off my career at Colorado State in '77, and I was asked to look at the needs of what they were seeing in extension staff regarding cardiovascular disease and high blood cholesterol. So I designed at that point the Healthy Heart Program. I got my first grant from the Colorado Heart Association at the time for a community grant. And again, I was interested to see, could we design a program that an individual could understand and then ultimately change their behavior to lower risk for cardiovascular disease. So we did all the physiological assessments and so on. And that program evolved all the way until I went on transitional appointment. From working in the community with extension agents, I would train around the state, physicians, dietitians, hospitals, other agency staff to better understand the role in nutrition and eating and heart disease. And then through that, we evolved into a continuing education course. I did it that was available for credit. It went nationwide. So those sort of programs have been gratifying to see how you always need to modify programs to meet the nutrition science information. Because what I do is translate nutrition science into messages and programs that I hope can influence positively the behavior of the person hearing it, receiving it, reading it, doing it online. And I took the La Cocina Saludable program, and it was in the early 90s, middle 90s, and I realized people are starting to put touchscreen kiosks in grocery stores. Why aren't we teaching that way? So I had a person, a graduate student who got her PhD, and what we did was we took the program that the grandmothers had taught, we took the elements of that, we videotaped some of their teaching, and we incorporated it into a touchscreen computer kiosk system. So it was positioned in a kiosk. A colleague in construction management worked with me on designing the actual kiosk, and it was all touchscreen, and the recipient could choose which language they wanted, English or Spanish. And it proved to be incredibly useful in waiting areas, because people wait for medical appointments, they wait for WIC, they wait and the seniors liked it because it gave them something else to do along with the meal site, the nutrition program for seniors offered at the noontime. So that became one that was positioned. We redesigned the kiosk, we worked in this, we've had it down in hospitals and clinics and walk-in clinics. So that's how programs have changed to meet technology, and I always have thought I've tried to keep abreast of what we should be delivering. I mean, a current project that's still going on this year is looking at delivering the nutrition education through social media using your Facebook. Mm-hmm. So, and I've looked to other ways of communicating, looking at how you can take technology and use it to deliver nutrition. But the cornerstone of what I've done in my career and the programs I've designed, whether it's something for the newsletters for the seniors, for example, to go with their meal site. We did all that on CDs, so it's now gone out of the state, and it's allowed people who are serving the elderly and the Department of Human Services to take this, give it all to their aging and adult services staff. They print them off, their newsletters, given to them at mealtime, sent home with the Meals on Wheels. So that's been, again, something that I've looked at different avenues to deliver information. Where at restaurants, I worked with the American Heart Association looking at Dine to Your Heart's Delight. What do we do on a restaurant menu to inform the customer that that item is meeting American Heart Association guidelines for fat, type of fat, sodium, the calories? And that one was, we worked that with Extension, implemented that statewide, for more than 10 years. And then when we were required to do and verify the nutrient content of the menu item, that's when we realized administrative costs were more than what we could bear. But that evolved to what is happening now in other programs addressing the point of choice when you go to a restaurant and dine out. You're now seeing these little decals on menus. You're now seeing people highlighting items that may be so many calories. So it's been an exciting career looking at how best to deliver nutrition education and how to reach people through various avenues and strategies. I did not know after my graduate degree in the department anything about extension until Dick Jansen, the department, had asked whether I'd come in because they needed help with FNEP. And it was like, oh, extension? Oh my word. You mean I've got opportunities in every county? So it allowed me, when I'm writing grants and looking for research dollars, to target certain communities. Hence the grant I mentioned initially with USDA to dovetail better the opportunities through extension in the counties and WIC to apply for that, because I had all the extension agents. I had connections. So if I was training and teaching as extension specialists need to do off campus, the extension agent would organize the workshops, the trainings. They'd arrange for Healthy Heart. They'd invite me to go to their diabetes workshop or their whole day health fair. Could I go and do a session on nutrition for this? So I had wonderful opportunities to travel. Oh, I learned a lot about Colorado, all the back roads, the high roads, learned to put chains on the car, learned to know how to get through in terrible weather. So I've had just a very rich and rewarding career, and it afforded me the opportunity to do something that is so exciting, because I had extension agents. They are from the university whose responsibility is to teach locally. So I could work with them in designing something that would help them. I'd get extension agents trained how to do focus groups so they could conduct the focus groups in their communities. I'd have extension agents on grants, and the graduate students also got to understand, and many of my past graduate students are having wonderful careers in extension. Some of my PhD students, former students, are now extension specialists in other universities like Virginia Tech. Helena Serrano was bilingual. She worked with me on La Cocina Saludable. She is now associate professor at Virginia Tech. Another student, Jamie Zollner, is also now at Virginia Tech, and she too has looked at what I try to do. And when I was hired, I was asked to design for the department a community nutrition program that would allow the department to be more connected to state agencies, to the other universities, to try to see what we could do in community nutrition public health to benefit the people in this state. And my job as a faculty member, I didn't teach that much in the classroom, but I did do for several years the senior seminar. I did a freshman seminar, and I taught the graduate course and designed the course with Pat Kendall on how you take nutrition education theory and practice, training graduate students, how do you take these models and framework and design the programs. So it's been a wonderful opportunity to bring the expertise and the research and design research, obtain funding, write the grants, look for different avenues to explore. Wow, that's exciting. So, and I got to choose. I mean, there's not a better job. My husband and I say we had the best jobs available, the opportunities that afforded us to create the research agenda we thought was exciting for us, to work with students and young minds and train them and see their success now. Incredibly rewarding. Well, when you look at challenges, there's challenges in any position. I mean, first thing that comes up, decreased funding. When we started with extension, I had a very good travel budget, operating budget, that allowed me to travel the state and work within regions, within aid, and offer the courses, have support from the university. That's changed. Now, is that necessarily bad? I think technology has afforded us wonderful opportunities to still connect, and which we do, and which we need to maintain. But things have changed. The challenges of, I found exciting to write grants and see if you really could get the money. Did somebody think you got a creative idea that was worthy of supporting, that would allow you to do the research, that allow you to work with students, and yet be able to apply that for within this state and across. And that I thought was, and I still think, the challenges are many. You never, and you never know. In the job of being an extension specialist, you do not know every day what's going to happen. I could have the media call, I can have a professional call, I would have physicians call asking me what's my best advice for da-da-da-da. It was wonderful. It was exciting. And I had a great colleague, Pat Kendall, to work with, and with her expertise in food science and food safety, and mine in nutrition and health, we had those respective positions, both within the department, and we just worked very well together. That was a joy to work with Pat and us to have our different personalities and styles. And, as you can probably tell, I like to talk. And so it was and I loved teaching. I loved teaching in the classroom. I loved teaching with the graduate students. But I also enjoyed getting out in the state and meeting the public and hearing what they had to say and understanding and changing how you were teaching them and creating for extension agents materials so that they could go on and deliver programs. We used to do all the slides, of course. So that's changed. And how you used to, and the cost you would have to do this, and the way we would present at national meetings, with the way we used to have to do our presentations for posters. And, we started off with overheads. I never did like overheads. So you try to get them made professionally. So it was an advantage to finally have a different way of communicating. And now computers, it's great. But computer technologies can be used to deliver very good programs. Lots of web-based programs. I've had research projects with students. One with the US Army, whereby we developed a program built upon the self-care for a healthy heart that I had initially designed with a PhD student from the Air Force Academy who came up to get his PhD with me. And we designed it to look at-risk military personnel. And in this last instance, we targeted those with heart disease risk, high blood cholesterol, high triglycerides. But we delivered the program through the web. And she now got further funding now that she has graduated with me more than 2 years ago now, 2 years ago. She's now implementing that and got her own research grant to test it in a larger population, taking her data that we gathered here at the university and applying it. Exciting, looking at technology. I think the challenges have been many, but I think they're challenges. They shouldn't be barriers. They shouldn't be barriers for you to still do effective programming, be a very good quality researcher. I think that's what I like, a challenge. Food Friends is the one that I got a grant for at the end of the 90s. And that was an interesting opportunity. It was funded by the Food and Nutrition Service of USDA. And we were one of the states selected to receive money. One criteria was to develop a nutrition network in the state of all agencies serving low-income, limited resource audiences. The second requirement was to develop a social marketing campaign built upon social marketing principles to address a very specific need in the state. So to ascertain what that was, we conducted focus groups. We had a first series of about 10, and then we had to go back out and do more because there wasn't a consensus as to which target audience we should address. It was the elderly or the very young child. In the end, with the reiteration of the focus groups with different people honing in on some of the issues, we were informed that the one behavior that they thought was really a cornerstone to good health and lifelong health was picky eating. And so we looked at the 3 to 5 year old because they could be segmented in a preschool, even though the audience people had thought should be addressed up to the age of 7. So we dealt with the 3 to 5 year old. And the first program was Food Friends, Fun with New Foods. And it was designed to overcome picky eating. And we built it on a social marketing framework, but we used social learning theory within the program that Head Start teachers, preschool teachers would be teaching their clients. We had research sites, obviously, and control groups and intervention groups. And we had a 12-week program because we verified that it does take 8 to 12 times for an unfamiliar food to be presented to a young child before they're willing to put it in their mouth and swallow it. They will spit it, chew it, squeeze it, throw it. All of the ideas of exploring food, which are normal behaviors in a young child. Then in the mid-90s, 1995, I like a challenge, and CDC made a major announcement and a bulletin and newspaper story saying, we have so much effort going with obesity programming to try to address the adult audience. Some people are getting into schools, but no one in this country is dealing with the preschoolers. And you need to start instilling good behaviors in the preschool age child. So I applied for a grant to USDA, National Research Initiative as it was called then, and got the funding to design a program to look at activity, fitness. But to do that, I quickly learned that you have to look at the gross motor skills. So I worked closely with Patty Davis, a professor in occupational therapy here on campus, and she would work with myself and Laura Bellows, who was obtaining her PhD with me, to do this. I said, this is your PhD work. We need to design this program. We made Food Friends get moving with mighty moves. So our Food Friends characters that we had from 1979-80, we then went ahead and managed to get them into looking at the preschool and how do we increase gross motor skills within the classroom. So we did 18 weeks, and teachers told us, again, you want to your target audience, what do they need, how do we do this? And they told us, tell us what to do, 15 minutes a day. How do we do it? What do we do? So it's very sequential, building on the gross motor skills, the manipulative, locomotive, and stability skills. And then we obviously did the measurements again with control groups and intervention sites. Again, they were Head Start around the site in rural and urban area. And then we saw that that was effective. And that program now, we refer to that as Mighty Moves. It's the shorter title, but get moving with Mighty Moves. So our little Food Friends characters learn their gross motor skills, then they get superpowers. And when they've got superpowers, they have the strength to do all these other things. And so we create what teachers wanted. You've got to have the child is very important for them to have imagination. We also were very careful to make sure throughout both of the programs, we incorporated all the Head Start framework and early childhood education guidelines and standards. So everything fits. So that's incredibly fun. And that's going well. We've got a very nice grant from the Colorado Health Foundation to support implementation of the programs in preschool classrooms in Colorado, and also in family child care homes, which is a nice new audience when you're looking at that. And then, of course, there's a home connection component, bilingual, to work with the parents, because that's an integral teacher for that young child. So they've gone extremely well and rigorously being implemented. It's been a rich and wonderful career. And the other thing I'd say about my career at Colorado State, there's not many people whose husband and wife could both have successful careers as professors on the campus. And my husband was the chemistry professor for 37 years, and I was with CSU for 34. And we both look at each other and say, what a wonderful opportunity Colorado State has given us. I think the success of all those who got PhDs with me is they've all obtained faculty positions or very good positions within their respective fields and interest. And I just had an introduction from Elena Serrano, who got her PhD with me and is now associate professor at Virginia Tech. And she introduced me to my granddaughter, as she called her. She just graduated her first PhD student. So, and this person is now a faculty member at Montana State. And that's fun because you do have this. You see and you hope that what you've trained your students to do, they will impart that knowledge to others, and so it can spread. And I think I had just with the retirement a card from a former student who said, well, you don't realize how much I've learned with you until you go to a place and I sit here and they're not talking to the target audience and they're not using a theoretical model to design materials. So I'm telling them, well, do you know what the audience wants? She said. So that's very gratifying. It's very nice to hear that and appreciate that when they think that what I'm making them do to learn how to design a program using the tenets from a behavior change theory, they actually get it in the end and understand, oh, whoa, this is the way we should do it. And then they are pleased to see results that really do show that this program has worked, and it's given you an opportunity to then go back and make it better, which I've also been keen to always do that. You've just got to keep things current and updated, especially in our field where nutrition science is so a changing field and an exciting, dynamic field. Students are also different needs, different backgrounds. People who did not come from undergraduate degrees in nutrition, who brought richness to my research group from being in public relations, being in journalism, looking at some. I have a graduate student currently who is still completing her master's thesis with me, and her background was business for 18 years. I've had other students who have been in computer technology and IT, and they bring that expertise, so you can understand with those backgrounds, you think, oh, this person would be ideal to work with me on a project that's looking at technology. And so that has really been rich. And perhaps one of the awards I really treasure above all other is the Jack Surma Graduate School Advising Award for the advising I gave to graduate students. Completely a surprise, a delight that they would recognize that what I've been doing in advising and mentoring graduate students was important and was recognized as it was. So I've really taken joy in thinking that some students put my nomination forward, so it was a big surprise and a delight, because graduate students they're all different. We're all unique. We're all different, and I've really, really enjoyed that. So I will miss that. So I'll go in the department and listen to seminars and, try and keep connected as long as one can. But it's just, yeah, it's fun.